Hi, I'm Dr. Molly with Your Goals Physical Therapy. Have you ever had like forearm tendinitis? Right? It's that pain that you get like in your forearm. It could be basically, if I'm just being general, it can be on either side of your arm, but it really hurts when you move your hand, when you grip. Most of the time, it starts off something kind of benign, like you typed too long one day and your arm's a little achy. Maybe using the mouse is a little tender. And then slowly over time, it kind of accumulates. And in some cases, it can get so devastating that it actually, you lose strength when you're gripping. So, like holding pots and pans or holding laundry baskets can be very difficult. Sometimes you get numbness and tingling. And I find that specifically when you get numbness and tingling, people tend to jump to the doctor's office, right? Because if anything that you lose your strength and it's numb, that can't be good, right? And typically Google doesn't really give you any information. It might tell you have tendinitis, it might tell you have carpal tunnel. And so you have to go to the doctor to find out a little bit more information, right? Because neither one of those sound really good. So, and then you go to the doctor and it's kind of like a lukewarm thing, right? You get there and they're like, well, it could be this, it could be that. Here, try these stretches, and they may give you a sheet of paper. Then they give you a prescription for medication. Try this. If it doesn't get better, then what I'll do is I'll refer you to an orthopedic surgeon. And that's when your brain says, what? I might need surgery? Because who needs to go to somebody with the title surgeon unless you're possibly going to have surgery, right? I mean, that's where my brain would go the moment somebody said that. And that's exactly where Tammy's mind went the moment her doctor told her the exact same thing when she went. And so Tammy then started like Googling like crazy just to figure out what else she could try to do to help, because her forearm pain wasn't going away. It was affecting cooking, it was affecting how she was cleaning, it was affecting doing laundry. I mean, let alone any recreational things. She wasn't even getting past her daily stuff, right? So she started asking all of her friends, and finally one of her friends suggested that she like just call me just to get some general information. And after we talked, and she started telling me, all the things that she'd been missing out on, and she really started to think about how long she'd been dealing with this. And let me tell you, moms, we put up with a lot just to make it through the end of our day, right? We will put up with we'll work through fevers, we've worked through aches and pains, because we just have to get to the end of the day and make sure that our little people are alive. Right, I mean that's what our goal is every day. And so, so when I got her in for the evaluation, she was like instantly relieved. She was able to close her fist without having too much discomfort. She had less just nagging pain in her forearm by the time she was done, and we had a clear plan. She knew what the goal was for the next time that we met, and she knew what her homework was, what she needed to kind of do to help her every day keep this from getting worse. And that was just a huge uplifting moment for her, because she really thought that she was looking at surgery. She thought she was looking at like injections or surgeries or something that was going to just take forever to recover from. So when she left the evaluation, it was like a huge weight had been lifted off of her, and all the worry and all the stress that she'd been carrying for months and months and months over this forearm pain were gone. I mean, we still have some ways to go with rehabbing her forearm, but just that anxiety that's associated with what's causing this pain and why is it still here and why doesn't it get better, that was all gone. And so I just wanted to share that wonderful story, and I hope that you're having a great week. If you're looking for this kind of care or you have any specific questions, feel free to direct message me. I field all sorts of questions. You have a great day. Bye.